Hello friends. Today we're going to explore 6 powerful medicinal plants that can be used as complementary therapy to help prevent and manage type 2 diabetes. These natural remedies have been studied for their effects on blood sugar levels, and many of them are easy to find, easy to grow, and simple to include in your daily routine. Type 2 diabetes is a condition that affects millions of people around the world, and the numbers are rising every year. It happens when the body doesn't produce enough insulin or becomes resistant to the insulin it does produce. This leads to elevated blood sugar levels that, over time, can silently damage vital organs. The eyes, kidneys, nerves, and heart can all be affected. If not properly managed, this condition can lead to complications such as vision loss, kidney failure, and even life-threatening cardiovascular issues. That's why it's so important to take action early, and not just through medication but by building healthier daily habits. In this channel we share natural health tips, home remedies, and plant-based solutions to support your well-being. So if you're interested in improving your health naturally and learning how to take better care of your body using time-tested remedies, I invite you to subscribe and join our community. You'll find practical advice that you can start applying today to feel better and live healthier. The main causes of type 2 diabetes are obesity and a sedentary lifestyle. But here's the good news. It can often be prevented or significantly improved through lifestyle changes. Eating a balanced diet, staying physically active, managing stress, and maintaining a healthy weight all play a huge role. While it's true that type 2 diabetes isn't considered curable, it is manageable. With the right approach, many people are able to keep their blood sugar levels under control and avoid complications. If you've been diagnosed with this condition, it's crucial to begin making positive changes right away. Even small steps can make a big difference over time. Regular monitoring of blood sugar, blood pressure, and cholesterol levels is essential. In some cases, a healthcare professional may prescribe medications to help manage the condition. Alongside these treatments, certain medicinal herbs have been shown to support insulin production, reduce resistance to insulin, lower blood sugar levels, and help minimize the complications of diabetes. These herbs are not a substitute for medical treatment, but they can play a helpful role in a well-rounded approach to wellness. Let's begin with dandelion. This wild herb is known for its many health benefits. Its leaves, stems, and flowers contain antioxidant compounds like chicoic acid and chlorogenic acid. These can help stimulate insulin secretion and slow down the digestion of carbohydrates and starches, thus reducing blood sugar levels. It's recommended to consume between 5 to 10 grams of dandelion leaves and flowers daily, either raw in salads or cooked. Dandelion grows naturally in the wild and can be recognized by its bright yellow flowers and toothed leaves, which resemble a lion's teeth. Next is guava, a tropical fruit that's considered one of the most nutritious in the world. Research has shown that guava can help reduce insulin resistance and improve the body's ability to process glucose. Up to 2 guavas can be eaten per day, ideally the whole fruit rather than juice, to ensure slower sugar absorption. Additionally, guava leaves can be used to prepare a tea. To make it, boil 1 tablespoon of chopped leaves or 4 to 5 whole leaves in a cup of water for 10 minutes. Let it rest for 5 more minutes and drink immediately. Up to 2 cups per day are recommended. Guava trees can grow up to 5 meters tall but can also be cultivated in pots with regular pruning. They require full sun and take about 4 years to start producing fruit. Now let's talk about fenugreek, a leguminous plant commonly used in Middle Eastern cooking. While the seeds are typically used ground in spice blends like curry, they also have a potent hypoglycemic effect. Fenugreek seeds contain fibers and compounds such as trigonelline and nicotinic acid, which help slow digestion and encourage insulin production. To benefit from fenugreek, consume 1 to 2 teaspoons of ground seeds daily. Since the seeds are hard, it's best to grind them or soak them overnight and eat them with a teaspoon in the morning. Fenugreek is easy to grow at home. It prefers spring planting and full sun and should be sown directly as it doesn't tolerate transplanting. Aloe vera is another plant with lesser-known benefits for diabetes management. One particular variety, Aloe barbadensis Miller, contains compounds that may help repair damaged insulin-producing cells in the pancreas. This variety has large, fleshy light green leaves with white thorns, and it produces yellow flowers in spring. Only the clear gel inside the leaf should be consumed. Avoid the yellow latex, aloins, which is toxic. To remove the latex, soak the leaf in water for a few hours until the water turns yellowish. Then extract the clear gel and blend it with a cup of water. Only 1 tablespoon of gel should be consumed daily, preferably after meals. The remaining leaf can be stored in the refrigerator in an airtight container for up to 1 week. Cinnamon is a common spice with big benefits. It contains an antioxidant called cinnamaldehyde acetate, which has insulin-like effects and may help lower blood glucose levels. Half a teaspoon of cinnamon powder per day, added to meals or beverages, can offer these benefits. It's important to distinguish between cassia cinnamon and Ceylon cinnamon. While both taste similar, Ceylon cinnamon contains much less coumarin, a substance that can be toxic in high doses. If you plan to consume cinnamon regularly, opt for Ceylon. However, cinnamon is not recommended for people taking blood thinners. Finally, ginger has been used for centuries in traditional medicine and has shown potential to lower blood sugar levels and boost insulin production. The recommendation is to consume 1 to 2 teaspoons of powdered ginger daily in food or teas. Ginger can also be grown at home. Plant rhizomes in spring and care for them through the summer. In autumn, once the leaves turn yellow, harvest the rhizomes. Keep some for future planting. These herbs are excellent allies in the fight against diabetes, but they should always be used alongside professional medical advice. It's essential to inform your healthcare provider if you decide to include these herbs in your diet, especially if you are pregnant, taking anticoagulants, or undergoing treatment for blood pressure. While this information is based on scientific research, it's always good to dig deeper and learn more on your own. These natural remedies offer a fascinating world of possibilities, from growing your own plants to exploring their healing properties. For those interested in learning more about medicinal plants, there's a whole world to explore. How they grow, what they're used for, and how they support health naturally. Keep exploring, keep learning, and remember, small steps toward a healthier life can make a big difference.